All right, guys, so we're picking up our topic here with what to do if you have a Medicare Advantage plan, like an HMO or a PPO, and you realize that you're going to be moving into a new coverage area. Well, Medicare lady here to explain it. So let's say the example is you have an HMO or a PPO plan, Medicare Advantage plan. That's what you've been using when you go to the doctor, the hospital, pick up prescriptions, etc. You really want to get into a Medicare supplement plan, like a Plan F, Plan G, Plan N, K, L, etc. So every state is going to have different rules, and every carrier is going to have a little bit of some different preferences on how they treat a move when you're moving outside of your Medicare Advantage plan area into a new area. What happens is when you move outside of your HMO or PPO Medicare Advantage plan coverage area, you could pick another HMO or PPO plan in the new area, or you could choose to go a different route, which is a Medicare supplement plan with a standalone prescription drug plan, and you can even look at a standalone dental or standalone vision. For some folks, this is exactly what they want to have. For other folks, this drives them crazy, don't even want to think about it. They're just happy with an HMO or PPO. So there's no wrong or right answer here, but let me tell you how it's done. If you're in a Medicare Advantage plan like an HMO or PPO, and you've heard so many good things about Medicare supplement plans or Medigap plans, like let's say it's a Plan F or a Plan G, and you want to do that. In some states, when you move into that area, and some carriers, they will definitely give you a guaranteed issue into a Plan F, a Plan K, a Plan L, and a Plan High Deductible F. A Plan G is in great, a Plan N is in nice. That's going to be a little hit or miss. Some states, like some carriers, in Illinois, for example, Blue Cross Blue Shield of Illinois, Plan F, Plan G, Plan N, Plan K, Plan L, high deductible Plan F, guaranteed issue every time. You're going to have a guaranteed issue into that plan. That's a really valuable thing. Other states, like New York, same thing, same idea. You're going to be guaranteed issue into it. Other states, it's going to be a little hit and miss. Some carriers may guarantee an issue or guarantee you into a Plan G or Plan N, and some carriers may not. So your best bet, if you're moving from, and this is my opinion, so when I say best, just know this is my opinion. If you're moving outside of your normal HMO or PPO coverage area, and you know you're going to have what they call a guaranteed issue by Medicare into a new supplement plan, I would closely look at the Plan F versus a high deductible F. Now, Plan F sounds really awesome because that's the Plan F, fancy full coverage kind of a plan. A high deductible Plan F really has a bad rap because the deductible for it is around $2,140 right now this year. From year to year, it's going to change and increase. So just know that you have a deductible that's a little over $2,140, right? Before the high deductible Plan F kicks in. However, you also have an extremely low premium. And you still have your Medicare Part A and B, which means that if you were to choose a high deductible Plan F, you're going to enjoy a very low monthly premium. You're only paying the deductibles or 20% co-insurance like you do with Medicare A and B. You get to see any doctor in the country that accepts Medicare. And it's only when and if you reach that high deductible that then it kicks into all the bells and whistles of a fancy full coverage Plan F. So my recommendation would be if you're in fairly good health and you're moving outside of your normal HMO or PPO area, let's pretend you're moving into an area that's kind of more rural, a little bit more laid back, not a lot of doctors nearby. Definitely go with a high deductible Plan F, because with that one, you're going to have guaranteed issue into the plan. Your premiums are going to be low. Sometimes they're as low as below $50, which is incredible. And you can see any doctor that you want to, which means you could go across state lines for all they care, and you can still use your high deductible Plan F, and you're going to be enjoying just paying like maybe the deductibles that are usual Medicare Part A and B and maybe 20% co-insurance, but there's going to be a safety net. There's going to be a cutoff that's around $2,140. So if, heaven forbid, something did happen, like you needed surgeries, you had a bad car accident, as soon as you reach that deductible, now suddenly you have all the bells and whistles of a fancy Plan F. And what's a fancy Plan F? I got a little tongue-tied on it. A fancy Plan F in Medicare means you pay your monthly premium, you walk into any doctor, any hospital that accepts Medicare, you don't pay a penny more, and you even have foreign travel emergency coverage. That's how fancy it is. It's awesome, and it's the one that almost everybody wants, but the premium is so high, and usually when you're healthy, you're not really going to the doctor that much, so it's like you're paying a lot for a premium that you don't really use. So it doesn't really make sense in many cases, except for, and this is, hear me out here, let's say you're somebody that has a serious illness or disease. Maybe you have cancer, you're on chemo, that type of a thing. If you have the opportunity to get into a Plan F, such as, i.e., for example, you are moving outside of your HMO or PPO area for your Medicare Advantage plan, or your Medicare Advantage plan or HMO or PPO area is abandoning the area, meaning they're jumping ship, they're getting out of the area. So it's out of no fault of your own, involuntarily, it's out of your control, you've been paying your premiums, doing everything right, and then either you're moving out of the area or the plan is moving on you because they're getting out of the county. That is your opportunity to get into a Plan F, as in you pay that monthly premium and you don't pay a penny more out of pocket for your hospital or medical. You're going to any doctor that accepts Medicare, plus you have foreign travel emergency. That would be the way to go. Well, we're going to talk about this more next time. I know I covered a lot of information really fast. Remember to go to medicare.gov or call 1-800-MEDICARE if you have any more questions. That's the government department for Medicare. And so with that in mind, just know I'm not pitching any specific insurance company per se, but I am definitely encouraging you to look at it, research it, and then decide for yourself what makes sense for you, your budget, your lifestyle, and what's important to you. Until then, have a great day.